Welcome back, Kin 610ers. Hopefully you are finished with the patient-rated outcome measures section of this module. And now what we are going to continue this module talking about is the disablement model and its use in clinical practice. When we talk about disablement, what we're referring to really is the impact of either an acute or chronic condition on the way a specific body system functions, right? And that body system could be something as simple as an ankle, or more complex, something like a liver or a kidney malfunctioning. To kind of further look at this, what we do is we look at how these health conditions impact our patients' ability to perform their daily activities, right? Their work tasks, their sport tasks, and their ability to just participate in their desired roles in society. This becomes a very valuable piece of information, I think, when you're treating your patients or your clients. I think it's kind of biased, right? As a clinician, we have this tendency, right, to kind of put on blinders and to focus strictly on the objective component of our assessment, those physical impairments. And we don't kind of move on to the patient's true functional limitations, to their disability, or to their societal limitations, which we'll talk about a little bit. For the average patient, what the reality is, they don't care about lacking 20 degrees of range of motion, or if their strength is 3 out of 5, or if their VO2 max isn't at an optimal level. But they do care about whether or not they can return to play on Friday night for a football game, or if they can perform their work duties, run after their kids in their yard, or go to, let's say, a weekly bingo game at the senior center. What the disablement model does is it provides this comprehensive framework for clinical practitioners to utilize evidence-based practice through the use of patient-reported outcome measures. It's the reason that the module starts with the patient-rated outcome measures first. So what we want to do next is we kind of want to dive into what the disablement model is. And so when we look at the disablement model, there are several different types. The one that I'm presenting to you, I borrowed from Mickliold et al. Because I really believe that she really presented one of the best ways to look at the disablement model in clinical practice. So what you have in front of you there are the 5 classifications in the disablement model. In other words, the things that we should include when we are working with a disablement model of patient treatment. And so the first thing that you see there is the origin, right? And the origin basically is the domain that allows the clinician to use diagnostic techniques to determine the dysfunction of tissue. The pathology of injury is identified through diagnostic testing. In other words, this is where we kind of determine the illness, the pathology, or the injury that is giving rise to the disability through the use of different diagnostic techniques. So that could be our special testing, that could be an MRI, that can be an X-ray, right? That's what we tend to do most often as clinicians in patient assessment. We spend a lot of time in this origin section. The next component is what we would call the organ level. And the organ level kind of encompasses both clinician and patient-based measures. And this really helps us determine the impairment. In other words, what we're doing is identifying the body system that is impaired. And that will kind of help us figure out what our treatment options are going to be. And so what we kind of do in this particular area is we're looking at, right, muscular weakness, swelling, range of motion, right? So you guys are getting this. We're using special tests here to determine the disability. And then here, what we're trying to do is determine the level of disability. So we're using our clinical special test to really figure out how much impairment or disability that patient actually has. Next, we move on to the person level. And the person level really encompasses those patient-rated outcome measures. This allows you to determine the effectiveness of the intervention, which we've already talked about in the patient-rated outcome section, so I'm not going to spend a whole bunch of time here. But what I will say is that these tools at the person level really allow the patient to kind of express their thoughts on their ability to perform functional tasks. And as I said in the patient-rated outcome measures online lecture is that this is vitally important. Because who cares if their range of motion improves? Who cares if their disability is gone if the patient still can't do the task that they need to do to live life on a daily basis? Next, what we have and what we don't talk about very often is this idea of the societal level. How does it impact the patient's ability to kind of really fit within the constructs of their society? So in other words, it's the effect of the injury on the overall health-related quality of life, right? Remember, we talked about that health on one side of the Venn diagram, quality of life on the other, and societal level really gets at that middle piece of the Venn diagram. We're really looking at not only health, but also quality of life and how both of those really help or hinder the patient from participating in what it is that they need to. So we can kind of look at this and say at the societal level, the patient can define the influence of their injury that it has on their impact in society. And we could look at this and say, well, the impact that it might have on their work environment, their familial roles, right? And again, we can use our patient-rated outcome measures to kind of get at this. What I will say is this. We're talking about patient-rated outcome measures here, and we're also talking about those measurements here. And so I want to be very specific. There are two different types of patient-rated outcome measures. Your specific patient-rated outcome measures probably would be applied at the person level, and then your more generalized or generic patient-rated outcomes would then be applied at the societal level. And then last but not least, we have this category of other. And so what does it actually mean? Well, to round out the disablement model, the patient is given the opportunity, believe that or not, to explain the personal and environmental factors that influence their perception of disablement. Again, very subjective in nature. And if you're a clinician, I don't know, sometimes I'm like, I don't want to hear this. I just want to assess. I want to figure out what your pathology is, and I want to treat you. Sometimes we don't really take the time to really look at what the patient's perception of their disability is. And so typically this is an opportunity that occurs through kind of patient assessment, patient interviews, and then those factors that are identified in this process really are used to determine the areas of treatment and rehabilitation. So all in all, what you can see is that this model is very comprehensive. The origin and organ level really are objective, right? And we'll spend most of our time here. But I really make the argument that we really should include these last three classifications, which are really taken into consideration the person, how it impacts their ability to not only do sports, but also really truly be successful in their role as a human being on this earth. And I really like these three classifications. The big deal is that they take a lot of time. So what I kind of wanted to do is walk through maybe an example of what the disablement model would look like in an ankle sprain model, maybe. And so what we kind of see here is the origin. Remember, we said overall the origin is what we use to kind of determine the disability or the type of tissue that is injured. And so we're going to use x-rays, we're going to use a bone scan, we're going to use an MRI to kind of rule out an anterior talofibular ligament sprain or a lateral ligament sprain. Do we have to use a radiograph or bone scan or MRI? No, there are other special tests that we could use, but these are the gold standard. So the first piece of the disablement model, again, is just identifying the actual disability. That disability in this particular example is going to be a lateral ankle sprain. At the organ level, once we've determined what the disability is, the next step is truly to kind of figure out what limitations does that patient have as a result, right, of the disability. And so at the organ level, we're going to use clinician-based measurements, but we're also going to use some patient-based measurements, not patient-rated outcome measures, but patient-based measures, and we'll talk about what those are. So our clinician-based measurements are going to be that manual muscle testing, so strength testing. We're going to do some girth measurements to see if there's swelling in the ankle joint. And then our patient-based measure might be something like a visual analog scale. In other words, how much pain is that patient in? And so we can say, okay, based on an ankle sprain model, they have decreased range of motion, and maybe their strength is reduced, and then they have a pain on a 6 of 10 when they maybe dorsiflex their foot or plantar flex their foot, right? So we can see how these two are mainly objective in nature, right? And this is what we as clinicians are kind of built to do in essence, right? Is really figure out the pathology, assess that pathology, and then where it gets kind of counterintuitive in a sense is at the person level. The person level, what we start doing is incorporating those specific patient-rated outcome measures, right? So these are self-reported questionnaires, and they're really based on patient subjectivity. And what we see, at least in the ankle, you guys should have gone through this patient-rated outcome measure, is that the FAM, or foot ankle ability measure, is a great tool in terms of applicability, comprehensiveness, validity, reliability. You guys remember all of those factors that you would consider in a patient-rated outcome measure? If so, the FAM has all 6 of those. And so it's a strong tool for the ankle joint and to assess function at the ankle joint. But there are others that we could look at, right? The DASH, trying to think of the low back pain, the ODI, Oswestry Index, right? So we can use specific patient-rated oriented outcome measures in the person level. And what those specific patient-rated outcome measures tell us is what they cannot do, right? And so in this case, we looked at the patient's foot and ankle ability measure sheet, and they circled could not jump off of one leg. That becomes important, right? I think it's more important than they have decreased range of motion and strength and they have a pain of 6. Well, now this is going to kind of drive my treatment. They can't jump off of one leg. So I'm going to start my treatment with 2-leg tasks. Hopefully that's making sense. At the societal level, we also want to do self-reported questionnaires. But again, we're looking at the overall health-related quality of life, right? So what we want to do is use a generic, comprehensive patient-rated outcome measure. And most often, that's usually the short form health survey 36. It's going to ask questions not just about the injury, but about things that they should normally be able to do in their regular daily tasks, such as, brushing your teeth, picking up your backpack, driving a car, things that a specific self-reported questionnaire wouldn't ask. And what this allows us to do is it allows us to see not only what tasks they can perform in their sport or at work, but just in life. Then last but not least is this other category. And I don't like the use of the word other because it implies that it's not important. The reality is it's just the miscellaneous category. And so I like the other category because what we do is we kind of interview the patient and we get this comprehensive assessment of really the person level and the societal level. And then what we do is we really want to figure out what else has this disability impacted. Is that patient now disconnected from their team? Did that patient lose a scholarship because they can no longer participate in their sport? Is that patient no longer invited to work parties because they don't come to work and they're on disability for 4 months? What other things that we missed in these 4 categories that would potentially hinder and or impact your patient's health or quality of life in society? So what we see again is this really comprehensive evaluation and assessment of our patient. And I like the disablement model because it really takes into account not only the objective measurements, but also the subjective measurements, which to me are just as important, if not more important. So as we conclude this online lecture, the disablement model serves 2 purposes, right? The first is to allow you to hypothesize potential ramifications of an injury on how specific body functions or specific body systems will function and how it will impact behavioral roles in daily life, right? But the second purpose is that it will describe environmental and personal factors that will either accelerate or slow down the healing process for your patient. As an athletic trainer, I see many benefits to using the disablement model in clinical practice, and I know that physical therapists are also using the disablement model as well, as I mentioned in the patient-rated outcome measures section. And even if you don't necessarily define it as their disability, you're defining it as an injury, the big deal is that that injury ultimately impacts how they function, ultimately impacts how successful they are in their sport, in their task. And so what I love about the disablement model is that it continues to allow me to use evidence-based practice in the most current research on treatment interventions for specific disabilities. And then I really like most is that it really allows me to treat my patients from a holistic perspective. I think especially as Christians, we know that our spiritual well-being really has a huge impact on us, right? And we cannot separate ourselves from that. I hope that we can't anyways. So if we do not treat our patient as a person, and we do not look at all aspects of their being, then we probably aren't being very successful in our treatment paradigms in our clinics. Societal factors, personal factors, and spiritual factors play a huge role in how a person heals. If their personal life has a lot of stressful things going on in it, it's going to affect the way that they heal, and it's going to affect the way that they view the treatment that they're getting from you, right? We've all had patients come into our clinic who maybe are depressed or stressed, and the way that treatment goes that day is completely different than when they're happy and they're energetic. So the disablement model really ultimately provides healthcare providers with a common language, which is hugely beneficial when your patient is being seen by a variety of healthcare professionals. And then lastly, the disablement model allows us as healthcare professionals really to determine the efficiency and the effectiveness of clinical interventions, not just with our objective measurements, but with our subjective measurements as well. And that, to me, will lead to more evidence for a variety of healthcare professions, but it will also improve your clinical outcomes. So throughout the rest of this module, we'll delve deep into the ins and outs of the disablement models. And as always, if you have any questions, please do not hesitate to get a hold of me via email.